Hello, future registered nurses. Welcome to another video with SM NCLEX reviews. Today we're going to discuss respiratory syncytial virus, otherwise known as RSV. Now today we're going to break down what RSV is, some signs and symptoms, risk factors, treatment, and how to prevent RSV. And of course, we'll be doing this while breaking down some practice questions. I think the best way for us to start is to look at some basics. So first, what is RSV? RSV is a virus that leads to infection and inflammation in the lungs. What time of year does RSV occur? You may be hearing a lot about RSV in those winter months. The winter months are when RSV is usually at its peak, but can also occur outside those winter months as well. It most commonly affects that pediatric population, particularly those aged 2 years or younger. But it's important to remember that can also affect adults. Typically, adults just get what seems to be a mild cold or like allergies. But when small babies get it, it can lead to respiratory distress or even hospitalization. Now, who might be at risk for RSV? Children less than 2 years of age are definitely at increased risk for getting RSV, and it tends to be more severe the younger that they are. Attending daycare or having siblings who attend daycare or school may lead to increased risk of exposure. We definitely need to think of our vulnerable populations here. Now, who might that include? Premature infants are at increased risk, babies less than 6 months old, children or adults with congenital heart defects and respiratory illnesses, and those 65 years or older. Now let's discuss some signs and symptoms we see with RSV. Can you think of any? Yes, so we may note some congestion or dry cough, low-grade fever, sore throat, even a headache. Symptoms typically develop around 4 to 6 days after exposure, and RSV can spread to the lower respiratory tract and even lead to pneumonia and bronchiolitis. What happens with these conditions? Bronchiolitis is when those small airway passages within the lungs get inflamed. And remember, even if we don't remember the medical term for something, we can still use our knowledge of medical terminology to figure it out. So, let's start with bronchio. Well, bronchio means bronchioles of the small airway in the lungs. And then itis just means inflammation. So don't let those big fancy words scare you. When I think of airway getting inflamed and narrow, what symptoms might you think of? I'm absolutely thinking of wheezing. Pneumonia is an infection of the lungs, either one or both. And this is where the alveoli, or the air sacs, fill up with fluid or pus. Now, clients may have some hypoxia present, which we might see some cyanosis, which is bluish discoloration of the skin, or around the mouth may be noted. Now, another respiratory symptom I think of here is retractions. You may see retractions just due to the effort of breathing in smaller infants. If we are suspecting RSV in an infant, you may also be wanting to ask if the child has been unusually tired or lethargic, and if the child is feeding okay. With all the increased effort of breathing, their bodies tend to get tired and can result in decreased appetite. But let's try a practice question first. All right, so a registered nurse is caring for a 12-month-old client who has been diagnosed with respiratory syncytial virus, RSV. What would be your appropriate nursing intervention? Let's take a look at our options. So A, administer acetylsalicylic acid as ordered. B, decrease the temperature of the room. C, give that client a cold bath. Or D, place a humidifier in the client's room. Now go ahead and pause if you need to, and we will review together on the next slide. All right, so the correct answer here is D, place a humidifier in the client's room. Now keep in mind, a client with RSV, it's a virus and mainly managed with supportive care. Now basically all that means is making sure that client is comfortable, keeping them hydrated, and administering things like antipyretics, such as acetaminophen as needed. Humidification, or basically finding a way to moisten the air, either through the use of a humidifier or steaming up a bathroom, makes it easier for that client to breathe. Now, when we're looking at our answer choice, A, keep in mind this is a 12-month-old. We almost never administer acetylsalicylic acid to children less than 12 months old. And do you remember why that is? That's risk for Ray's syndrome. So, for this client, we could use ibuprofen or acetaminophen, but not acetylsalicylic acid. That would be an inappropriate intervention. Then, looking at our other two choices, both a cold bath and a cool room could actually cause increased difficulty breathing. So those would be advised against as well. So now let's talk about some other forms of management other than supportive care. So the nurse may expect steroids or IV fluids to be ordered by the provider if the client is admitted to the hospital. The fluids can help prevent dehydration because oftentimes when infants are admitted with RSV, they're too exhausted to eat or drink. Now, dehydration happens so quickly, so we definitely want to prevent it if we can. And steroids can help decrease the inflammation in the lungs and make it easier for the client to breathe. Oxygenation may be needed as well to combat hypoxia. Do we need to be thinking about antibiotics here? Well, RSV is a virus, not a bacterial infection. So unfortunately, antibiotics won't work at this time. Now, one thing I do want to add though is frequent suctioning of mucus. These kids have so much mucus and congestion in their lungs, so frequent suctioning can help improve their breathing and decrease their workload. Another large component in pediatric nursing is recognizing if our client's symptoms are worsening or improving. So let's try a practice question on this topic. The question you're going to see here is considered a next generation NCLEX question. Let's take a look. So we have a client that's diagnosed with RSV. The registered nurse understands the client is at risk for blank and blank due to blank. So we're looking at findings and conditions here. Same as the last question, you can go ahead and pause if you need to and jump right back in when you are ready. Let's go to the next slide to look at our answers. So, the correct answer here is a client is diagnosed with respiratory syncytial virus. The registered nurse understands that the client is at risk for bronchiolitis and pneumonia due to increased secretions. So remember, we discussed earlier, the most common cause of bronchiolitis and pneumonia is RSV. RSV is a lower respiratory infection that may present with lots of secretions. So our client may be at increased risk for developing these, which means the client should be treated to manage symptoms. So that would be things like oral hydration, utilizing a humidifier, and treating with ibuprofen or acetaminophen as needed. Now, caregivers should be educated on warning signs to watch out for, which we'll cover here in a minute. Now let's review some of our options. Now, fatigue is an early stage symptom and can be managed with at-home rest. While fatigue may impact the child's ability to clear secretions, the secretions are the main risk here, making it less correct. Now, fever is a finding we would already expect to see in this client due to infection. And cyanosis indicates worsening oxygenation perfusion and thus requires immediate medical attention. Croup and pneumothorax are typically not complications we see in RSV. Now, our goal for these clients is to make sure they're getting appropriate oxygenation and staying hydrated. It is important to educate clients and caretakers when to seek care from an emergency room or for medical management. Now, can you think of what some of those might be? As nurses, we should always be assessing our clients, especially looking for any signs of respiratory distress, fever, or dehydration from our client here. Now, these are our red flags. A big thing to watch out for and educate caregivers on is for signs and symptoms of respiratory distress. I like to use the mnemonic diaphragm, which stands for diaphoresis or sweating, hypoxia, lower oxygenation saturation levels, respiratory rate, gasping, accessory muscle use. We see this in a client that's having trouble here and increased workload for breathing. And this helps me assess my client for any change in status and for any symptoms that may indicate respiratory distress. Now remember, the earlier we intervene, the better, as the client can go downhill quickly. Now, frequent hand washing is our best form of primary prevention. Also, avoiding contact with sick individuals, especially if our client is more at risk. We must also be making sure we're educating clients about the importance of vaccinations and staying up to date. A new vaccine has been approved by the FDA for those 60 years and older, specifically those who have underlying conditions that affect their cardiac, respiratory, or immune system. And there has been a new vaccine also approved by the FDA that is recommended for infants born during RSV season or those up to 24 months of age. It's still in the early stages, but that's great news, and hopefully will start to lessen the severity of the disease. Now, thanks for joining me today. Keep studying hard, future registered nurses. You're all doing great. Make sure you hit that subscribe button so you don't miss out on our latest YouTube video. And we will see you next time. Bye.